Hi Moira, how are you today? So I've been discussing a few things with the team and I'd just like to have a little chat with you just to discuss what the problems are and just to see if there's anything we can do to make your life a little bit healthier and happier and help you cope a little bit better with what you're going through at the moment. So first of all, we understand that you've been diagnosed with early onset emphysema. You've got shortness of breath, you're experiencing fatigue, and you've got a very, very bad cough, a chronic cough. We know that all systems of the body are interrelated and they all work together to keep a person in good health. So with the problems that you're experiencing at the moment, they're cardiovascular and respiratory. Now, we know that the respiratory system consists of the airway, the lungs, the diaphragm, and other muscles of respiration. And the cardiovascular system consists of the heart, arteries, the veins, and the capillaries. Now, the cardiovascular system's central organ is the heart, which pumps blood to the different parts of your body. The blood travels from the heart to the lungs, where the respiratory system supplies the blood with oxygen. So you inhale air through your nose or your mouth, and it passes through your pharynx, larynx, trachea, and finally to the lungs, where it diffuses in the blood through the alveoli. Now, what's happening with you is that you're a smoker, and this is compromising your airway, and there's not enough air going into your lungs. And this is usually caused from, and this is usually the cause of emphysema, basically. So what you've been diagnosed with is emphysema, which is a lung condition that causes shortness of breath. In people with emphysema, the air sacs in the lungs, the alveoli, are damaged. So over time, the inner walls of the air sac weaken and rupture, creating larger air spaces instead of smaller ones. So one of the cardiovascular common diseases is coronary heart disease. Now, the underlying cause of this is when the coronary arteries become narrowed due to a slow buildup of fatty deposits. These are called plaque. And the coronary arteries are the blood vessels that supply the heart with blood. Now, it is a problem that could be caused by smoking and diet. And we know that you're smoking 40 cigarettes a day. If you have a cardiovascular disease, you have high blood pressure, and you will be more at risk if you smoke. And also if you are overweight and you eat fatty foods. Also, you'll be more at risk of heart problems if you are physically inactive, so not much exercise, have diabetes, high cholesterol, are socially isolated, or you have depression, or you're anxious. Now, we know you're very anxious about Jack and how he's going, and this has a negative impact on your body. Moira, we are looking at ways we can reduce your likelihood of having a stroke or a heart attack. Common respiratory disorders and diseases include bronchitis, asthma, and lung cancer. And these are because the chest becomes rigid and that the cardiovascular system can't work properly, and there's a decrease of blood flow to the lungs. A cough is what you have, a very bad cough. and that is affecting your ability to breathe effectively. So emphysema is a lung condition, and that causes shortness of breath. In people with emphysema, the air sacs into the lungs, the alveoli, are damaged. Over time, the inner walls of the air sacs weaken and rupture. So the diagnosis is not very good, so life expectancy could be 5 years. There is no cure, but it is treatable with the appropriate management, and that's what we're going to talk about, which can reduce the symptoms and improve your quality of life and help you stay out of hospital. So Moira, we know that smoking is one of the main causes of emphysema, but we can slow it down and help relieve the symptoms. It's up to you if you want to take an active role in managing your health, so that you can have as much time as possible with Jack, who loves you dearly and is feeling very stressed when he hears you coughing. So first of all, we have to look at ways of giving up smoking, and there are numerous methods which your doctor can talk to you about, such as patches, Champex, which reduces your cravings for nicotine and may help you stop smoking. So what do you think you will feel if you give up smoking? So apparently after 12 hours, the carbon monoxide levels in your blood reduce and the oxygen level in blood increases to normal. So after 1 day, your chance of having a heart attack decreases. After 2 days, your sense of smell and your taste improves as your nerve endings start to heal. So your whole body system is interrelated: the nervous system, the digestive system, and the respiratory and cardiovascular systems. It all works together, all of it. And you've been very, very stressed lately, so that is making your condition worse. So what I'd like to do is look at ways we can reduce your stress. So I've spoken to Jack about ways he can improve his health. He's going through early puberty and he's very conscious about his acne at the moment. He'd also like to meet some people of his own age, so we're looking at strategies and places where he can go to join groups of people with similar ages, possibly music orientated because he likes that. This would hopefully put less pressure on yourself if you know that he is happier and he's made friends and he's feeling better about himself. So the other thing we can look at is your diet. Now, we understand that you're eating a lot of fatty foods, and this is probably because of the stress you're under with Jack and trying to do everything for him, and you're neglecting yourself. So if we can sit down and work out some healthy meal plans, coming into summer you can make some healthy salads that are very easy to make, and that would be better than eating the fatty fried foods which clog up your system. So there is research that says that foods that you eat can affect emphysema because everything is interconnected. So if we can possibly change your diet, cut out the fried foods, and also that'll improve digestion, cut out soft drinks and drink water or something with less sugar in it, and cut out excess salt. So if we can sit down and with the team look at some healthy salad ideas as an alternative, and the motto, everything in moderation, is a good rule. It's a good idea to meal prep, so that sort of relieves the pressure of wondering what you're going to eat. And maybe we do that a week at a time. So you are less likely to buy takeaways. You can shop for the ingredients and then you know what you're having every day for dinner. Breakfast can be muesli and yogurt, or fruit and yogurt. We can spend some time doing some meal preps and looking at recipes, and just see what works for you and start making you feel healthier and better. Now, the other thing is exercise. We know that inactive people have more chance of having heart attacks. So what we can do is start off with very slow walks. You'll feel so much more energetic when you actually do a little bit of exercise, and you have better lung capacity if you can give up smoking. Breathing exercises, we could try some yoga, and we just know that exercise will increase your cardiovascular activity, your cardiovascular capacity. So Moira, we're hoping that we can work with you to help you have a healthier, happier lifestyle. We can just do it slowly, take baby steps, and hopefully you will spend more time with your beautiful Jack.